And joining me now from our Environment Desk is Valerie Dekimpe. Valerie, this is clearly a developing story, but so far, what do we know about the situation here in France?
So 5 French nationals, as you were saying, were on board that ship and are now being treated at a hospital north of Paris, Hôpital Bichat. Their health is being closely monitored. They are in quarantine for 15 days, but could remain in isolation for 42 days if deemed necessary. Now, one of those passengers, a French woman, has now been tested positive for hantavirus. She developed symptoms on the plane, a plane that was specifically chartered for those 5 French passengers. Her condition got worse and she tested positive this morning. Now, you also mentioned 22 other French nationals who have been ordered to self-isolate. Who are they specifically? So 8 people traveled on a flight from the island of St. Helena in the Atlantic Ocean, and 14 other passengers on a flight from Johannesburg in South Africa to Amsterdam. So those are not people who were in contact with the French woman who has now been tested positive and who is at hospital. Those are people who traveled on planes. And where the story gets a little bit tricky is that passengers who were traveling on the cruise ship, about 29 of them from 12 nationalities, were allowed to disembark from the cruise ship on April 24th after the first fatality, that Dutch man, 70-year-old man who died of hantavirus. And so among the people who were allowed to disembark, you had the Dutch wife of that passenger. So she was on the flight from St. Helena to South Africa, and she was also on board the plane from Johannesburg to Amsterdam, but she was so ill that a decision was made to actually remove her from the plane, and then she was hospitalized and she passed away in Johannesburg. So the 22 French nationals were people traveling on those planes, so they weren't in contact with one of the first cases of hantavirus.
Let's talk about the virus itself. The Andes strain has been identified as a possible source of this outbreak. What do we know about it?
Well, hantaviruses in general spread from rodents to humans, so droppings, urine, saliva, when those particles become airborne. And in rare cases, it can also be transmitted from people to people. There are about 40 strains of hantavirus found all over the world, and different strains cause different illnesses. But now we're talking about the Andes strain, which is typically found in South America. It's the only strain that is known to transmit from people, from person to person, and through respiratory droplets. So when we cough, when we sneeze, when we talk. The virus, though, this particular strain, can also spread through bodily fluids. And so in countries like Chile or Argentina, cases of hantavirus are not that uncommon. Every year, dozens of cases are reported, not necessarily of the Andes strain, which can be transmitted from person to person. But what doctors say in their experience of that strain in particular is that it does spread through very close contact. So people who live together, people in relationships or intimate contact. And so that is also but potentially explained why the virus spread in that cruise ship with, very little ventilation and very, dense population of people in a confined space.
Now, of course, when we heard about this story this morning in the newsroom, there's a lot of discussion about are we going to go back to wearing masks and having plexiglass dividers between our respective desks. But the World Health Organization has been very quick, hasn't it, Valerie, to reassure the public about the risk of a pandemic. So how is hantavirus different from COVID?
Right. I mean, the WHO has been very clear that this is not the start of a new pandemic. What we know is that hantaviruses, they do have a high fatality rate, so ranging from 20 to 50%, which is a lot higher than what we know of COVID, which is about 1.7% fatality rate based on numbers that we have from 2020. The big difference, apart from fatality rates, is the transmission, the rate of transmission. And so COVID-19 resulted in a pandemic because it is extremely transmissible. So it's an airborne illness where the virus spreads through tiny aerosols, just being in a room or the ventilation. Hantaviruses are different in what I was saying earlier, and the WHO has also been very clear about this, is that it requires very close, intimate contact, so people living together in relationships and so on. And so that's the main difference between them, a much less transmissible hantavirus. Another important point is that there is no evidence currently to suggest that the Andes strain of the hantavirus can mutate and therefore adapt itself to its host, human host, and therefore become more transmissible, which is also what happened with COVID-19. And so overall, what the WHO is saying is that this is, of course, a serious situation that they are following very closely and being treated as such, but it does not pose a major health risk for the global population.
Valerie Dekimpe, thank you so much.